So it's a new world out there, guys. We have to prepare for it. You cannot be in a reactive state. It will create a ton of fires that you don't even really need or want to deal with.
You an entrepreneur, I got what you need.
Hey there, my loves. Welcome back to my channel and CPTV, the place for aspiring and growing entrepreneurs who want to turn their passions into businesses and their businesses into freedom. This is the place where I am dropping the golden nuggets and giving you the tips, the tools, the blueprints, and the step-by-step strategies that are actionable for you to implement and grow your dream into that 6 or 7 figure empire so that you can enjoy the freedoms that come along with entrepreneurship. If that sounds good to you, then this is the place that you are going to want to come to. Every single week, we are dropping the golden nuggets, and I'm very excited to have you here. So make sure that you like this, that you subscribe, and that you share all the good goods with your fellow entrepreneurs, because I think that from my years of experience and 20 years of being an entrepreneur, that my experiences can be your lessons to learn immediately. I'm Cheryl Perez, or CP, as my CP TV family calls me, and I would like to tell you, first off, congratulations. We have spent the entire month of April implementing strategies to mitigate the spread of the coronavirus, and I must say, we have done an amazing job. We have, in what they call, flattened the curve in most of our states, and because we did our due diligence and implemented those strategies, we have been successful at decreasing what we originally thought was going to be a crazy spread of this virus. And if you recall, just a little over 4 weeks ago, I came out and talked to you guys specifically about implementing your HR plan so that you could actually mitigate and navigate through the stay-at-home orders and the quarantine orders that were being rolled out state by state across the country. Well, now those same stay-at-home orders and quarantine orders are in the process of being relaxed or eliminated altogether. And that means that we need to talk about how to navigate what your HR game plan really should be and is going to be as you begin to slowly bring your workforce back to work. The question that I've been getting a lot is, now what, CP? And that's exactly what I'm going to talk to you about today. We are going to focus on what your HR game plan should look like as we start focusing on post-COVID-19, post-pandemic, and what our new normal is really going to look like. It's so important for you to have an actual HR game plan in place, because even though the states may have come back and said, hey, non-essential businesses can open up again, that doesn't necessarily mean that we are not going to be dealing with coronavirus and COVID-19 for the foreseeable future. And so with that being said, to avoid spikes, to avoid additional shutdowns, to avoid additional quarantines, you are going to want to implement some specific HR plans and strategies as you begin to bring your folks back to work. And today I'm going to teach you step by step what that post-COVID-19 game plan should really look like. And of course, as always, I'm going to give you an amazing free downloadable for you to access. So make sure that down in the description box, you go ahead and grab your post-COVID-19 HR checklist. It's going to really be a table of contents of what you should include in your post-COVID-19 HR game plan and playbook. And I'm going to dive into what the specifics are of that right now. So let's get to work. So let's really talk about what your first step is going to be. And this first step is really the fact that you need to focus on and prioritize creating a post-pandemic return to work game plan. Again, don't forget to grab that downloadable that's right underneath this video, but you really do need to sit down and take a moment to really think through what your new playbook for your workplace is going to look like. One of the first steps that I want you to make sure that you do is to gather your team. There's a team of key stakeholders in your organization, and I need you guys to meet and actually work through what your messaging is going to look like post-COVID-19 as we begin to slowly migrate and bring employees back to work. I'm going to give you the framework today, but you've got to promise me that you're going to gather that team and that you guys are going to sit down and think through some of the key areas that we're going to focus on today, because you really do have to have some decisions made. And ultimately, you have to know exactly what and when you're going to communicate this information to your employees. I also want you to take kind of an interesting step, but I need you to pick and identify a workplace coordinator. And that workplace coordinator's job is going to be primarily their responsibility for the COVID-19 issues and their impact on your workplace, especially as it exists from an HR perspective. Now, in most organizations, this is going to be your HR staff, your HR team, your person on your team that's in charge of human resources. It might even be you. But ultimately, you need to identify who that person is so that they can be that primary point of contact. And when you're communicating to your employees what your processes and policies and steps should be as you continue to kind of deal with this virus, you're going to want them to know who to reach out to, who to ask questions of, who to talk about concerns with. And that one workplace coordinator is going to be critical. If you don't have one point of contact and you haven't communicated that to your team, then it can get really, really tricky with them sharing information, talking to supervisors, talking to coworkers, especially when it comes to medical information. It kind of gets tricky with HIPAA and EEO. So you want to make sure that you've got a designated person on staff that is clearly identified and that your employees know that they can turn to when it comes to the future of what your new normal is really going to look like. Another thing that I want you to make sure that you focus on is discussing some very specific areas and working on creating your overall playbook. Again, grab that free template. It is going to give you a checklist of a table of contents that you should include in your playbook, and it's going to help you navigate through this conversation. So when you look at this checklist and this table of contents, you and that key stakeholder team, as well as your workplace coordinator, are going to sit down and talk about and hash through exactly what you want things to look like. And of course, being a big HR client and a big HR hero client, you always have access to all of the resources and tools as you think through these policies, these practices, and these procedures by accessing your COVID-19 toolkit. So make sure that you go out and grab that. Now, the final thing that I want you to do, as you and your team have kind of come up with exactly what you want everything to look like, you've worked through that checklist and that table of content, you've begun to jot down some notes of what you want to communicate to your team, I need you to schedule an all-staff meeting and training to roll everything out. You do not want to address these issues as they happen. I am encouraging you to be extremely proactive in this approach. We kind of know in most states, actually, some of them are opening up later on this week. Some of them open up May 1st at the time of this recording. So it's really important for you to begin to communicate with your employees what things are going to look like as they begin to receive communication and information from you. So my recommendation would be to schedule an all-staff meeting either that first day back or an all-staff Zoom meeting prior to that first day back whenever you feel comfortable reopening and actually bringing people back to work. Schedule that employee meeting and begin to roll out your playbook. Educate them on the following 3 areas that I'm getting ready to dive into with you right now, and make sure that they really understand what your policies are, what your practices are, what your processes should look like, and that you communicate your basic expectations for hygiene, for sanitization, and for keeping the rest of your employees safe. Remember, you still as an employer have a duty of care. Regardless of whether or not your state is saying, we're going to be open, no restrictions, no protocols in place, you need to take the due diligence and the time to implement some protocols that are going to keep your team safe, because they really are relying on you. And ultimately, as an employer, you have a responsibility through OSHA and through some very specific federal laws to keep your employees safe. So the onus and the responsibility is really going to be on you, which is why this playbook is so important. So let's dive into what the 3 areas of focus in your playbook are, and really things that you're going to want to think through as you begin to comprise your playbook and roll out that education and communication to your employees. So area number 1, practice and policies that will reduce transmissions among employees. This is a major area in your post-pandemic HR playbook. You are going to want to sit down and come up with all of the practices, the processes, and the policies that you are going to roll out as it relates to how to reduce transmission among employees. And some specific things that you're going to want to address in this very important area. Number one, how are you going to handle sick and symptomatic employees? There's very specific language the CDC has come out with, and the EEOC actually came down and relaxed some of the rules and regulations surround temperature checking, for instance. I get a ton of questions from folks on whether or not they can mandate their employees to take their temperatures. So there's tons of guidance. Make sure you access it. And they actually came out and said, yes, employers can take temperatures of employees. However, there's some very specific things that you're going to want to stick to when it comes to taking temperatures. So I give you that example because I really want you to think about how you are going to handle sick employees and those who are actually showing signs and symptoms. Even though our states may be saying, non-essential businesses can go back to work, we can begin to slowly bring our employees back and rebuild our economy, we're still going to be dealing with this virus. People are still going to be exposed to it, and people may still be getting sick. And if that's the case and they're in your workplace, you are going to want to have specific processes and specific procedures in place on how you're going to handle those employees. So make sure that you do your due diligence. Access all of the information in your COVID-19 toolkit and begin to devise what that plan is going to look like handling sick and symptomatic employees. If you're going to dismiss them and have them go home, if you're going to mandate quarantine, if you know for a fact that they've been exposed, all of those different things need to be put in place. And if you're unsure of what you can and cannot do, access the information, reach out to our help team, our help desk, and ultimately make sure that you've got all of your I's dotted and all of your T's crossed. The second thing in area one that I want to make sure you think about is what your employee education and training on the spread of the disease and the specifics of what that's going to look like. You want to make sure that you have discussed with your employees the basic expectations that you have of hygiene and sanitation and not sharing their items or their workspaces or their workstations. Make sure that you've considered what that's going to look like. Also, what are your protocols going to be? What should your employees do if they've been exposed to a COVID-19 transmission or if they've actually been diagnosed with it? You want to make sure that you've got a step-by-step that you can teach them what they need to do, who to notify, ultimately your workplace coordinator, how to request the sick time, how the Emergency Family Medical Leave Act applies to them, how paid sick leave applies to them, what ultimately they should do if they've been concerned about actually receiving a transmission, being exposed to COVID-19, or actually being diagnosed. You are also going to want to thoroughly educate your employees on the practices of social distancing that you are going to employ in your organization. Are you going to move workstations further apart? Are you going to ensure that, there's demarcations on the floor of what 6 feet apart looks like? All of those things you're going to want to make sure that you have in place, and then you're going to want to ultimately educate your employees on what that looks like. All of these things in area one are really designed to help you take the responsibility of educating your employees and rolling out how to reduce the transmission. You're going to want to make sure that you're addressing this area because it's going to be critical to your duty of care, but also to making sure that you don't have high spikes in absenteeism, that you don't end up having to shut down regardless of the government simply because everybody on your team is sick, and ultimately that you're not exposing employees, their loved ones, their families, but also clients to an actual transmission. So make sure you're thinking about area one thoroughly and come up with your game plan step by step and educate your team on it. The second area in your return to work post-COVID-19 area toolkit playbook that I want you to make sure you're thinking about is the practices and policies on a healthy business operations. These are things that you're going to want to think through. First, are you going to implement flexible sick leave policies and procedures? This is where the Emergency Family Medical Leave Act, the Corona First, Families First Virus Act that came out is ultimately going to play a role. Remember, even if you're bringing people back to work, those acts are in place at least right now through December 31st, 2020. So that means that your employees will still be eligible for some of those things, some of those times, and some of those claims. You want to make sure that you take a real deep dive into what your current sick leave policies look like, and you make sure that you are prepared to discuss with your employees what it's going to look like, because you don't want employees who've been exposed or who feel sick or who feel symptomatic to feel obligated to come back to work. And you don't want those folks saying that they feared that they were going to lose their job, that they weren't going to get paid, and that's why they didn't say anything. So make sure that you are really thinking through from a business operations perspective what those flexible sick leave policies and that emergency family medical leave is going to look like. You also want to do a complete and thorough assessment of what essential functions exist in your organization. And that means which employees you have to bring back into the workplace and which employees can continue to work from home. The running theme in all of our states, regardless of whether they're eliminating these policies or they're just reducing them, is if you've got employees that have been set up to work from home and that's working well for you and you're able to continue to function from a business perspective, keep them working from home. The more you can eliminate massive amounts of people coming back into your workplace, the better for your workplace, the better for our communities, and the better for all of our health. So assess who's essential, who has to come back, and ultimately who can continue to stay at home and continue business as usual. Do that assessment, figure out which positions those are, and only really talk to the people that you feel need to come back about coming back, and everybody else, let them know you're going to continue work as usual and they're going to continue to be able to do their jobs from home safely. Also, make sure that you have made a determination around things like essential travel and essential client interactions. If there is any way, shape, or form that you can continue to limit the amount of travel or eliminate the amount of travel that your employees have to endure in order to keep them safe and to keep your workplace safe and to keep their families safe and so on and so forth, please make sure you implement those. If you've done a really good job over the course of the month of April at actually instituting Zoom calls or client meetings via virtual mechanisms, then continue to do that. Now, if you have a situation where you've been kind of shut down because your employees need to actually go out and meet with clients face to face, make sure that you have a conversation with those employees about wearing masks, about keeping themselves sanitized, about hand sanitizer, about keeping social distancing practices, because you ultimately want to keep your clients safe as well. So those are essential things that you want to make sure that you've thought through and put and included in this playbook. Another specific thing in area 2, the healthy business operations aspect of things, is you're going to want to prepare for spikes in absenteeism. Look, even though they're relaxing the restrictions because our economy just can't take any more weeks of being shut down, it doesn't mean that the virus is gone. We definitely don't have any kind of vaccine. We definitely don't have any kind of medications and cures. And so the disease still exists and people can still contract it and people can still get sick from it. You really want to begin to prepare yourself what your plan is going to be in the event that you have a spike in absenteeism, in the event that there is an exposure in your place of business or that an employee in themselves have been exposed and then ultimately spread it to other employees. You may begin to see a spike in absenteeism, especially people who have, like, let's just say allergies, and they're really not sure if what they're experiencing is an allergic reaction to something or COVID-19 symptoms. Those are going to be people that you're going to want to practice the safety first and say, stay home. Let's see what's going on. That's an absenteeism. So just be prepared what that game plan is going to look like. Make sure your employees are clear on who to reach out to, what to do, and ultimately what your policies and practices are going to be. And make sure that you re-educate yourself on what that Emergency Family Medical Leave Act and that paid sick leave order looks like so that you are prepared to begin to process those and to keep people safe on and off the job. And finally, in the area number 2 of healthy business operations, I really want you to spend some time coming up with what your social distancing policies and procedures are going to look like. Now, there are some things that I would suggest, and these are just some cool tips that we've implemented, that we've encouraged our clients to implement, and that I really think are going to help. First of all, maybe you can stagger start times for your employees. Have some folks start at 8, some start at 8:15, some start at 8:30, some start at 8:45, just so that you don't have hordes of people starting at the time clock or coming in at the exact same time. Also, stagger lunch breaks so that not everybody is congregating together in large groups in the kitchen or in the cafeteria. Think about staggering break times and end times. Those are all some ways that you might be able to implement social distancing, and that might be a new policy for you moving forward. Also, think about adding space requirements to workspaces. Make sure that if people are working on a manufacturing floor, or if they're in cubicles, or if they're in open workspaces, that they're at least 6 feet apart. Maybe even think about putting some barriers in between open workstations or cubicle areas, and making sure that you've got some social distancing things in place. I've been going to the stores and seeing X's on the floor, these little things that you can buy. One of the girls at the gas station yesterday told me that she ordered them. She's the owner, ordered them for her gas station on Amazon, believe it or not. And they're just things that she has on the floor. She's measured them out and they are 6 feet apart so that people, when they come in to the counter, they know where to stand if they're waiting in line. Things like that from a social distancing perspective are definite considerations for you, but you want to get your workspace together. You want to get your spacing and your social distancing requirements together. And again, if you have been utilizing remote virtual meetings or remote virtual work, keep doing that. Do not change that. Unless they're an essential employee and you really feel like they need to come back, do as much of that remote work and virtual meetings as possible. And area number 3 that I want you to really think about and address in your HR post-COVID-19 playbook is practices and policies to maintain healthy work environments. That means, what are you going to put in place in order to make sure that everyone is practicing healthy, hygienic, and sanitized work environments? What are your respiratory and hygiene practices going to look like? What is your routine environmental cleaning and distribution and disinfection policies and practices going to look like? And then what are your enhanced disinfection practices and policies going to look like in the event that there is a COVID-19 exposure in your workplace? So that really means, are you going to require your employees to wear masks at all time? And then think about, if you are you going to supply them with options for those masks? Remember in our HR plan before this whole thing, how we talked about making sure that you had hand sanitizer on site, that you had Lysol sprays on site, that you had the ability for your employees to wash their hands frequently or to use that hand sanitizer? You are going to want to double down and triple down on those exact same practices. Adding into this mix, however, this newfound information on wearing masks. Now, I've gotten questions from clients that say, should I go out and stock up on masks? Yes, it cannot hurt. Now, I would definitely encourage your employees to tell them, because I think that most states are going to be rolling out protocols requiring, if you're out in public or if you're in the community, to wear masks. But ultimately, if an employee has their own mask, tell them that they need to wear it. But if they don't have one, or if they haven't been able to secure one, make sure that you've got a stash available on site for your employees to actually utilize, because that is going to be important. Making sure that you've got hand sanitizer and Lysol at every area, making sure that you are wiping the workspaces down, and that that's your policy and procedure. So a policy could include something like this. At the end of every workday, everyone is required to grab some Lysol wipes, wipe down their computer, wipe down their keyboard, wipe down their area, or grab a Lysol can and spray everything down at the end of every workday and at the beginning of every workday. Maybe you want to institute something that says beginning of workday, lunchtime, and end of workday. And you also want to be clear that if there is exposure to COVID-19 and someone in your workplace has symptoms or has been diagnosed, what your thorough disinfecting policy is going to look like. So you might say, if we have a transmission here at the employer, here at this organization, the office will be closed the following day for a complete and thorough professional company to come in and disinfect the entire area, or for the management team to come in and disinfect the entire area. You want to make sure that you've got those enhanced disinfection policies and practices ready to go, and being very proactive in that area as well. So those 3 areas are important, but I've got a few other tips and tools that I really want you to consider. First, add posters around your workplace to reinforce that education that you've done with your employees. Whether it's hygiene reminders or designating social distancing, 6 feet apart locators, you can access a bunch of different posters in your COVID-19 toolkit as well. But make sure that you have put them everywhere. Maybe you hang them in everyone's cubicle, just to remind everybody to wash their hands, to sanitize, to disinfect their workspaces, and to keep everyone safe, and to keep their masks on at all times. Also, you are going to want to advise your employees to keep an eye on themselves and to check themselves for symptoms. The CDC has tons of resources and tools out there. Your COVID-19 toolkit has tons of resources and tools, and it's really designed to give your employees information on what the symptoms could include, how to check their temperatures properly, and if they suspect or they're not feeling well, to just just stay home. Also, make sure that you are really thinking through whether or not local travel or even airplane, international, or national travel is even necessary right now. And maybe you just take a stance and say we're eliminating all travel until the fall or until brighter days come. And then also make sure that you still got in place the option for video conferencing and virtual meetings. Because if you have a conference room that seats 8 or 10 and everybody is crammed in there for an actual staff meeting or a departmental meeting, it can really be kind of deterring what you've put in place already from a safe workplace and safe environment perspective. So just make sure that you are over educating and that you are doing your due diligence in protecting your employees and fulfilling that duty of care that you ultimately have. Now, the CDC does have some amazing resources, guidance, and tools. Make sure you access it. Many of our states' Department of Health have some amazing resources and tools. And as a big HR Hero client, you've got it all in one place, one-stop shop. So access everything that you need from your COVID-19 toolkit. And again, don't forget, my focus in this video was to teach you about the fact that you need to create a return to work game plan and playbook. Make sure that you grab that checklist. It's absolutely free. It's got your table of contents in it, and it's got the real areas that I just went over with you for you to discuss with your key stakeholders, with your team. Designate that workplace coordinator, and it's going to walk you through all the stuff that you've got to figure out. So it's a new world out there, guys. We have to prepare for it. You cannot be in a reactive state. It will create a ton of fires that you don't even really need or want to deal with. So make sure that you take the tips and the tools and the things that I just went over with you today. You take that checklist, you do what you've got to do, you apply that due diligence, because the future of what our world really looks like post-COVID-19 is that we're not really post-COVID-19, right? We're still in the thick of it. And you as an employer need to be able to pivot, to turn, to take care of your employees, take care of your clients, but most importantly, take care of yourselves and your families. It has been an amazing time. Thank you so much for watching. Thank you so much for joining. Let me know any feedback that you have. Make sure that you smash that like button, subscribe to this channel to get all the tips that you need every single week. And until next time, my loves, I will see you soon. Have a wonderful, wonderful day and stay safe out there. Bye-bye. Mwah.